when you first have an attack, the worst thing you can do is to ignore it and think it's going to go away. When you first develop a migraine and you have an acute medication, we want you to take it right away, because what we've learned is that the false alarm rate in an early migraine is very low. In other words, when people think, I think I'm going to get a migraine, guess what? They're going to get a migraine. And the longer they wait to treat, the less likely it is to respond to the treatment. The most common acute medications that we use are called triptans, and there are a variety of formulations of the different triptans: pills, nasal sprays, injections. They work based on turning off these nerves called trigeminal nerves, which are very important in the pathology of a migraine. We still occasionally use ergots. We don't use them very much. We used to use them all the time. They're probably not as effective and probably not as safe as a triptan. Anti-inflammatories are very important. Many of them are over the counter, although you often need a decent dose in order to stop a migraine. Migraines are inflammatory, so it's certainly rational to think that an anti-inflammatory could help treat a migraine. Well, the thing that's most likely to work in a patient to stop a migraine, other than medication, is a nap. We'd like you to lay down and see if you can possibly fall asleep, because sleep is often very effective to abort an individual attack. For people who are not big caffeine users, taking caffeine at that time as well can be helpful. The real expert migraine patients learn what the earliest symptoms of their attacks are, and they learn to treat at that point.